I'm going to perform the first room scan. Hello, my name is Rachel Burt, and I am currently a student at the University of South Alabama, and I am an BSN to DNP student with the specialty of family nurse practitioner, and I am going to be filming a neurological assessment video for my course NU518 Advanced Nursing Assessment. Can you tell me your full name?
Thomas Burt.
Do I have your consent to film you for the purposes of grading?
Yes.
Okay. So I'm going to start my neurological assessment by looking at my patient's physical appearance. The first thing that I notice is that the patient is alert and relaxed. He's sitting in an upright position with good posture. He's able to maintain good eye contact. He's dressed appropriately for his age and the season. And right now, he seems like he has a pretty good affect. Now I'm going to assess the patient's orientation by asking you a few questions. Can you tell me your name and date of birth?
Thomas Burt, 10/16/89.
Can you tell me today's date?
April 3rd, 2026.
Can you tell me where you are right now?
I'm at home.
Okay. Who is the President of the United States?
Donald Trump.
Okay. So the patient was able to answer all of the orientation questions correctly. So he is alert and oriented ×4 to person, place, time, and situation. Okay, now that I have performed that portion of the assessment, I am going to assess the patient's mood and affect. In the past 2 weeks, have you been feeling down, depressed, or hopeless?
No.
In the past 2 weeks, have you found little to no pleasure in doing things that you normally like to do?
No.
Okay, the patient denies these questions, so his mood and affect is appropriate. Moving forward, I'm going to assess the patient's immediate memory, recent memory, and delayed recall. Okay, Mr. Burt, can you repeat this phrase after me? The dog is red.
The dog is red.
Okay. Can you tell me where you went to college?
Alcorn State University.
Okay. Can you repeat the phrase that I just had you say just a moment ago?
The dog is red.
Okay. The patient's recent memory and delayed recall are intact. Okay. Now I am going to assess the patient's judgment. If you were to find a lost child, what would you do?
I would notify the authorities.
Okay. The patient's judgment is intact. His response is appropriate. Okay. Now I'm going to assess the patient's abstract thinking abilities. Can you tell me a couple of things that cats and dogs have in common?
They're both pets and they both have 4 legs.
Okay, very good. Can you tell me what the phrase "don't cry over spilled milk" means?
Don't worry about the little things.
Okay. The patient answers appropriately, so I'm going to say that his abstract thinking skills are intact. Okay. Now I'm going to test the patient's calculatory abilities. Can you tell me what 7 times 8 is?
56.
Can you subtract 12 from 8?
4.
Okay. What is 12 times 4?
48.
Okay, very good. The patient answers the questions correctly. His calculatory abilities are intact. Now that I have finished that portion of the assessment, the mental status portion, I am going to move on to assessing the patient's 12 cranial nerves. I'm going to start with cranial nerve 1. That is the olfactory nerve. Mr. Burt, I'm going to have you cover up one nostril and take a deep breath. Okay, now I'm going to have you cover up the opposite side and take a deep breath. patient's nares are patent. Okay, Mr. Bird, now I'm going to have you close your eyes, and I'm going to have you close one nostril and take a deep sniff and tell me what you smell. What do you smell?
Peanut butter.
Okay. Other nostril.
Oranges.
The patient identifies both scents correctly, so I'm going to conclude that cranial nerve 1 is indeed intact. Okay, now I'm going to move on to cranial nerve 2, which is the optic nerve. I'm going to begin by giving the patient a Rosenbaum chart. I'm going to have the patient hold it out at least 14 inches. That is what you would normally hold reading material at. Okay, Mr. Bird, I'm going to have you cover up one eye, and I'm going to have you read the smallest line that you can.
LTFPH.
Okay, I'm going to have you switch and cover up your opposite eye.
LTFPH.
Okay, based off of the patient's responses, his vision, or his near vision rather, is 20/20. If the patient wears corrective lenses or contacts, you want to make sure that they're wearing them for the assessment. If you wanted to test the patient's distant vision, you would have the patient look at a Snellen chart at 20 feet away, and you would have the patient cover one eye and then the other reading the smallest line that they can. The top number for the patient's vision is the distance that they're standing, so 20, and then the bottom number represents what a normal patient can see, or a normal vision patient can see at that distance. Okay, I'm going to determine that the patient's vision is 20/20, and I'm going to conclude the assessment of optic nerve 2, cranial nerve 2, I'm sorry. Now I'm going to assess cranial nerves 3, 4, and 6. Okay, I'm going to shine a light in your eyes. The patient's eyes are, what I'm looking for is the patient's size and shape of his pupils. The patient's pupils are equal, round, and reactive to light and accommodation, and the size of his pupils are 6 millimeters. Okay, now I'm going to have you focus on my pen light and don't move your head. Okay, the patient doesn't have any issues with convergence. Now I'm going to test your vision with, your ocular, I'm going to test your the six cardinal fields of gaze. So I'm going to have you focus on my pen light. You can only move your eyes. You cannot move your head, okay? During this portion of the assessment, I am assessing the patient for nystagmus, strabismus, or ptosis, which is the drooping of the eyelid. I did not note any jerky or irregular movements, so I'm going to conclude that the patient's cranial nerve 3, 4, and 6 are intact. Now I'm going to test the patient's cranial nerve 5, which is the trigeminal nerve. And so to begin this portion of the assessment, I'm going to assess the patient's strength in his temporal and masseter muscles. So to perform that, I'm just gonna place both of my hands on both sides of your cheeks, and I'm gonna ask you to do a few commands, okay? Can you clench your jaw? Can you relax your jaw? Can you open your mouth? Can you make your jaw go side to side? Okay? The patient demonstrates smooth, symmetrical movement with good strength. So now I'm going to assess the patient's sense of sensation. So with this object, I'm going to prick your face or touch your face, and I need you to close your eyes and tell me if you're feeling a sharp or dull sensation, okay?
Dull. Dull. Sharp. Sharp. Dull. Dull.
Okay. The patient was able to accurately identify dull and sharp sensation, so I'm going to conclude that cranial nerve 5 is intact. Now I'm going to move on to cranial nerve 7, which is the facial nerve. So I'm going to first be observing the patient's face for symmetry or any irregular or jerky type tics or movements of the face. And so I'm going to ask you to do a series of commands, okay? Can you raise your eyebrows? Can you close your eyes and don't let me lift them? Okay. Can you smile, frown, puff out your cheeks? Okay. The patient is able to accurately perform each one of the commands for the facial movements. So I'm going to conclude that the facial nerve, cranial nerve 7 is intact. Okay, now I'm going to assess a cranial nerve 8, which is the vestibulocochlear nerve. And so to perform that test, you have to do a whisper test. And so I'm going to have you cover up one ear while I whisper a phrase in your ear, and you have to tell me what that phrase is, okay?
The dog is red.
Okay, can you cover up your other ear?
The sky is blue.
Okay. The patient was able to accurately identify the phrases whispered to him. I will be looking for auditory irregularities, but in this patient I didn't note any, so I'm going to conclude that the patient's cranial nerve 8 is intact. Okay, now I'm going to move on to cranial nerves 9 and 10, the vagus nerve and the glossopharyngeal nerve. So to begin, I'm going to have you stick out your tongue as far as you can. Okay. Now I'm going to assess the patient's uvula. Say ah. Say ah. Okay. The patient's uvula is midline and his soft palate elevates symmetrically. Now I'm going to test the patient's gag reflex. Okay, the patient's gag reflex is intact. Now I am going to assess the patient's swallowing. Can you take a sip of water for me? Okay. The patient's swallowing is intact. And I noted symmetrical, even movement of his neck muscles while swallowing. Okay, I am gonna move on. The patient's cranial nerves 9 and 10 are intact. Now I'm gonna move on to cranial nerve 11, which is the spinal accessory nerve. And so I am going to place both hands on the patient's trapezius muscles, and I'm going to have him shrug against resistance. Okay, the patient has good strength bilaterally, symmetrical movement. Now I'm going to move on, and I am going to test the patient's sternocleidomastoid mastoid muscle by having the patient turn his head against resistance. This side. The patient has strong muscle movement and coordinated movements bilaterally. So I will conclude that the patient's cranial nerve 11 is intact. Now I'm going to assess the patient's cranial nerve 12, and that is the hypoglossal nerve. I'm going to be assessing first for the patient's speech. Can you repeat this phrase? I am smart.
I am smart.
Okay. The patient was able to accurately repeat the phrase back. Okay. Now can you stick out your tongue for me? The patient's tongue is midline and I don't note any atrophy. Can you move your tongue from side to side? Okay. The patient is able to move his tongue from side to side with no difficulties. The movements were strong and symmetrical. Okay, you can close your mouth. Next, I am going to to conclude the cranial nerve assessment, and I am going to move on to the cerebellar function portion of the assessment. That's going to test for fine motor and coordination skills. Okay, so to begin, I'm going to ask the patient to take both of his hands and place them on his thighs, and I'm going to ask you to flip your hands back and forth as fast as you can. Okay, the patient is able to perform that task without difficulty. His movements were symmetric, smooth, and coordinated. So now I'm going to ask you to walk down your fingers, and you're going to touch each finger to your thumb. Okay. The patient is able to have coordinated movements and no difficulty performing that task. Okay, now I am going to have the patient patient take his heel and run it down the front of his shin of his opposite leg. Okay, the patient performs that portion of the assessment without any difficulties. So I'm going smooth coordinated movements. So I'm going to move on and assess the patient's gait. So I'm going to have you stand. And I'm going to have you walk back and forth. patient's gait is steady, he has good balance and posture, and I did not note any gait abnormalities. The patient also had a symmetrical arm swing. I didn't notice any abnormalities, like I said. Okay, can you now perform a tandem toe to heel walk where you'll go from heel to toe as you walk? The patient is able to perform the tandem heel to toe walk without any difficulties. So now I'm going to move on and perform the Romberg test. I'm going to ask the patient to hold his feet together and close his eyes and try not to move. Okay, the patient has been able to stand without moving. There's minimal swaying, and so the patient has a negative Romberg test. If he were having to sit down at this point, that would be a positive Romberg test. Okay, you can have a seat. What is this object?
A pin.
Okay, that is testing for stereogenesis, and that is the ability to immediately recall what an object is without really thinking about it. Okay, now I'm going to assess the patient's tendon reflexes. So to begin, when you're grading tendon reflexes, you have a grading scale of 0 to 4, with 2+ being normal. I'm going to start by assessing the patient's bicep tendon reflex. So I'm going to make sure that the patient's arms are relaxed. I'm going to place my thumb on the patient's bicep tendon, and I'm going to strike my thumb. Going to test the other side now. Okay. Did have some slight movement in the upper arm, so I'm going to say that the patient's bicep tendon reflex is 2+ bilaterally. Okay, next I'm going to assess the patient's tricep. The tricep tendon reflex. I'm going to make sure that the patient's arm is relaxed. I'm going to hold the patient's forearm and strike the patient's tricep tendon. Now the other side. Okay. The patient has slight movement, so I'm going to say that he has a 2+ bilateral reflexes in his tricep tendons. Now I'm going to test the patient's brachioradialis. So I'm going to make sure that the patient's arm is relaxed. And I'm going to use the back of my reflex hammer to strike the patient's brachioradialis tendon. The patient's brachioradialis tendon reflex is 2+ bilaterally. Now I'm going to test the patient's patellar reflex by striking the patient's knees. Okay. Patient's reflexes are 2+ for his patellar tendon reflexes. Now I'm going to assess the Achilles tendon reflex I'm going to place the patient's leg on my arm and let the weight of his leg rest on my arm and strike the Achilles tendon. Okay. I did note some movement in the back of the patient's leg. That's something that you won't always find. Okay, relax your leg. The patient's Achilles tendon reflex is 2+ bilaterally. Now I'm going to test the patient for Babinski sign. So I'm going to get the patient's foot. I'm going to start at his heel, work my way up. Alright, so when you're testing the Babinski sign, what you saw in the patient is that he had a negative Babinski sign, and that's when the toes curl downward. If his toes were to fan out, that would be a positive Babinski sign and an abnormal finding. Now I'm going to test for ankle clonus. And so I'm going to hold the patient's leg and I'm going to do some backward movements and then hold. Okay, no oscillations noted. No oscillations noted bilaterally. There is no ankle clonus noted. That concludes my neurological assessment. I'm going to perform the final room scan.